So in 2025, there's going to be some major differences in Medicare. And we saw that with the open enrollment in 2024 because a lot of Medicare Advantage plans dropped their customers and a lot of people went to Medigap plans or had to change to a Medicare Advantage. But in this video, I want to explain to you why the two best plans are Medigap Plan G and Plan N. And I also want to explain the differences between the two of them so that you understand which one you want to decide on. Because in my mind, they're both fantastic plans, but it's up to the individual on which one of these plans they think is better. So let's dive into the numbers. Everyone that's going on to Medicare in 2025 is going to pay $185 a month for their red, white, and blue card. That's what you pay to the government each month to get that 80% coverage. Now, if you're a low income earner, it could be less than that. And if you're a higher income earner, it could be more than 185. But the bulk of the population is going to pay $185 a month for that red, white, and blue card, which is going to be your coverage from original Medicare. And then on top of that, to cover that the additional things that Medicare doesn't cover, 99.9% of my clients are going to get a Plan G or a Plan N. And I'm going to show you the reason for that in this video. Now, if you look at the screen, you see Medicare Advantage on the left-hand side. You see Medicare Advantage, Plan G, and Plan N. I'm not going to talk about the Advantage plans because I do that in some of my other videos. So if you want to know the difference between the Advantage plans and the Gap plans, you can watch some of my other videos. But in this video, I'm going to go over the difference between G and N. So if we look at the premiums, now on here, I did an average of the country. Keep in mind, there's 50 states. You have some states that are really high in price, like New York. You have other states that are really low in price, like some areas in Texas. So I did an average of someone who is 65 years old. So if you're 75 or you're 80, you're going to have to put more money onto what these premiums are going to be, because the premiums go by your age, your gender, and your zip code for most of the states. So for Plan G, an average is going to be $155 a month, and for Plan N, it's going to be $120. Now that's a $35 difference, and I'm going to show you some of the differences in here so that you'll decide whether you think the $35 is a big deal or not, and which one you want to go with. Now, keep in mind, you still have to tack on that $185 a month that you're going to pay to the government. So let's start with hospitalization. For both of these plans, you're going to pay zero staying over in the hospital or having surgeries or anything. So it's equal with both of these plans. Next up would be doctor and specialists. Now, each one of these plans, you're going to pay the Part B deductible for the whole year. It's going to be $257. It's not that expensive. Some deductibles, as you know, for plans could be $7,000. This is only $257 for the entire year. But for both of these plans, you're going to pay that deductible first when you go to the doctor or the specialist, or anything that has to do with Part B, which would be medical. After you're done paying the $257, you're done with Plan G. You do not pay anything to doctors, specialists, outpatient centers. So basically, you pay nothing for hospital, ambulance, MRIs, CAT scans, chemotherapy, physical therapy, surgeries, anything. You're done after you pay that $257. Now with the Plan N, you're done paying everything when it comes to hospital, surgeries, CAT scans, chemotherapy, physical therapy, except for you pay up to $20. It could be 10, it could be 15, but it's up to $20 each time you go to the doctor or the specialist. Another thing that you pay for that I probably didn't put on this chart is you pay a $50 emergency room fee unless you're admitted into the emergency room. So basically, those are the two differences between G and N, the big differences. Pay up to a $20 copay with N, and you pay a $50 emergency room fee unless you're admitted into the hospital. Now, there's only one other difference, and that's an excess charge, and I'll get into that at the end of the video. But like I always tell my clients, I've been doing this for 17 years, and I know a lot of agents and brokers in the business, and I personally have never seen anyone get an excess charge. So that's a lot of years and a lot of people and a lot of clients. Let's do CAT scans and MRIs. So both of them are zero. Like I said, a lot of my clients say, well, I don't know about the plan N because, what if I have a CAT scan? How much is that going to cost? Or how much is a surgery? Like I said, the only differences are that $20 and $50 for the most part. Skilled nursing. This is what is huge. Let me scroll this down. When it comes to skilled nursing, both of these plans, you get 100 days of skilled nursing. Now, I'm just going to mention this one thing. If you look up top, the 21 day 1 through 20 for Medicare Advantage, you pay zero, but you only get 20 days with Medicare Advantage. Both of these plans, N and G, you get 100 days of skilled nursing. Fantastic. Ambulance is both going to be zero. And like I said, everything pretty much that Plan G covers, Plan N covers, except for the $20 and $50. Now, I did my math a little bit wrong here because I didn't update this for the maximum out of pocket. But basically, we can do this together. I'll do it on my phone. So with Plan G, you just take the 155, multiply that by 12, which is going to be 155 times 12, 1,860. You're going to add that $257 deductible because most people are going to go to the doctor, specialist, whatever, and they're going to pay that. So let's add that, and that's $257 added. So your maximum out of pocket for Plan G is going to be $2,117. So let's switch this right now. 2,117. And there you have it. That's going to be your maximum out of pocket for Plan G. Now, when I do these videos, everyone gets on my case and says, well, you didn't add the $185 a month. So you're right. So that's $2,000, $2,117 for the Plan G. And then you're going to add 185 times 12 if you want to count the government. That's going to be an additional $2,220. So approximately $4,500, let's say, for a Plan G for pretty much your whole package. Now, if I slide down here, a drug plan. If you're not taking a lot of drugs, maybe there are a couple of generics, you can get a drug plan for $0. Some of them are even $5 a month. So you can tack that on. But most of my clients are paying less than $10 a month for their drug plan. Only other thing is dental, vision, and hearing. These plans do not come with those plans. You can get a separate one for between $10 and $40 a month from most companies. I won't get into that, but you can tack that number on. Some people don't even get a dental plan. They just pay out of pocket. Now let's slide down to Plan N. Let's go a little bit here. Maximum out of pocket is going to be $120. Now keep in mind, this is not for everybody. This is an average. $120 times 12, $1,440 plus $257 for that deductible comes to $1,697. Now, it's hard to add a maximum out of pocket. It's pretty much what I have over here, except for the fact that you have to add how many times you're going to go to the doctors. So let's go say you go to the doctors 10 times that year, 2025. Let's add that. That's going to be $200. $20 times 10. So your maximum out of pocket is going to be $1,717. So as you can see, some people pay less for the Plan N, but some people go to the doctors, go to the specialist all the time. They could go once a week, 4 times a month. Then it starts to get a little bit more pricier. But as you can see, a lot of times people save money with the Plan N. Now keep in mind, you have to add that $185 a month because like everything else, you're going to pay for that. That's it for this video. Plan G and Plan N are both fantastic plans. 50% of my clients are on G, the other 50 are on N pretty much. I mean, I haven't done the exact numbers, but they're both the best plans that you can get in the country. Thanks so much for watching this video, and I'll see you at the next one.